All right. So, and I don't think red marker is the best one here. I'm going to switch back to black. I think it's going to show up better. Okay. So upper traps. All right. Where's the top border of the shoulder blade? If I can find the top border of the shoulder blade, that means that, who's that? Levator scap. Okay. And now you can check the exact like origin insertion of rhomboids, but they run like that. Rhomboid major and minor, kind of to the middle of the shoulder blade. So let's see. You know he's got some. We could also have him push back into my hand. Can also make him pop those puppies out. Okay. Push your elbow back into me. And relax. Okay. And we know lower traps is hitting this inferior angle, so we can literally just push down into my hand. No, that's more lats. Push back into my hand. We can draw loosely. Is lower traps and mid traps, are they usually hypertonic? They're not. I'm going to show you how to needle them. I don't think you'll ever need to know how to needle them. Okay. More beneficial for these guys is probably thoracic manip, bone, and bone. If they're inhibited, usually that's why. There's research study. T8 through T10 is restricted. Lats. This lower traps shows lower level of activation, like on electromyogram, whatever. And then we manipulate T8, T10, and right away there's an increase in muscle activation. Joint dysfunction can cause what? Muscle inhibition. Lower traps are usually inhibited. Middle traps are usually inhibited. Serratus anterior, which we're not going to needle, is usually inhibited. So we definitely want to needle rhomboids. And like I said, we can selectively target levator scap. So if you wanted to do that, we're just going to do a pinch technique. Where's the top of my shoulder blade? Pull your shoulder blade up to your head. Pull it up to your head. And you're just going to pinch this chunk right here. This is upper traps, right? That's upper traps. This is going to be more levator scap. It's a little harder to do here. I prefer to do levator scap right here at the base of the neck. There's upper traps and levator scap. If you do the paraspinals, you've already hit levator scap. This is redundant, all right? But if you want to know how to do it, find the top border of the shoulder blade, pinch it on up, and then we can needle in here. You're probably going to get some upper traps too. That's fine, okay? You do want to make sure you don't peel the muscles so far up we're in la-la land, because levator scap is living down here. So we're going to be close to the body. My fingers are here and here. So between my fingers, there are no ribs and there is no lungs. Okay, so as long as I needle towards those fingers, I can needle here, I can needle here, I can needle here. Maybe we hedge our bets and go kind of right in the middle, right? And I can feel muscle bulk, all right? So we can pinch up levator scap. In the same way, we can pinch up rhomboids, but maybe what can we do here to give ourselves some slack on that muscle? We could put a pillow or something. Can I have one of these pillows?
Arm behind the head.
Relax.
Did you not internally rotate it to like...
Internally rotated like that.
Arm behind the back.
This is going to be one of the positions that we're going to needle rhomboids and also subscap. We're going to come onto the front of the shoulder blade from this direction. Kind of crazy. I think we'll have time today if we can practice pinch levator scap, pinch these rhomboids. If we can practice those two, then let's go ahead and come and do, there's two that we're going to do with the hand behind the back. We'll do them together. You guys want me to go ahead and show you that? Yeah. All right. Because these are easy, right? Levator scap, rhomboids, Rhomboids, just kind of find that muscle bulk, push back into my hand. Right, there's the muscles, relax. Try your best to pinch them up. Right. Needle towards my thumb, and then done. And if you can't hold on good enough, then maybe you just pass on this position, okay? Put the shoulder back as far as you can, get a couple pillows under there, and if you can get that to pop up, and we can needle it, great, but it's not my favorite, right? But you can do it, okay? So there's only 2 more we're gonna do here and today, so we'll have 4 total. I'm gonna put the hand behind the back. Are you all right in this position? Not every shoulder patient is gonna tolerate this position, right? Like how many of our shoulder patients? Not that many, right? The good news is, mostly we use this for subscap, and we can do subscap much easier another way. I don't love this. Are you okay here? So he's a big, strong guy. He's pretty tight. We're not getting a lot of winging here, but it is enough. So we know how rhomboids come and attach onto the shoulder blade. So we can needle the rhomboids at their attachment site to the shoulder blade. So we can use the edge of the shoulder blade. So just like we've done before, we're gonna curl under shoulder blade. We're gonna curl around the edge of the shoulder blade, and I can needle this window. As long as my fingers are on that bone, I can needle along that bone. And we got some good rhomboids here, so yeah, we can come needle that guy right there.
You're aiming at the rhomboids here?
Yeah.
Okay.
So we know if you have your shoulder blade drawn, loosely drawn, rhomboids are gonna come and hit maybe like the middle third, maybe a little bit up from there. You can have the patient turn that muscle on to find it. There's also a muscle belt. Look, if I push here, there's nothing. If I push here, we got something there. That's rhomboids, okay? Nothing there. You can feel that muscle bulk. So, well, if you need to turn them on, push your shoulder blade back into my hand, right? Just make him turn it on, okay? That's why I chose him, because you guys will see it easily and stuff like that. So if you can't find it on your patient, ask for help, all right? I think we want to get to that point. At that point, if we can get the shoulder blade to reflect enough, then we can actually, where's that shoulder model? Can I have it? 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 Okay, cool. You guys know where subscap lives? All right. Okay. So if we can get that shoulder blade to reflect enough, and some people, we're going to get it to reflect a lot. Now guess what? And if here's my ribs, you can palpate where those ribs are, and as long as you stay north of those ribs, right? So depending on how much that shoulder blade wings, he's a little iffy. I would say I probably wouldn't want any of you guys, unless you can really position the pillow well and stuff like that. Like I can do it. It's a small treatment window. So if it's y'all's first time, find a good shoulder blade to do it on, right? This is gonna be one of the ones that you don't wanna play with. You gotta know what you're doing here. See how we're like parallel with the plane of the body? We're not gonna hit any ribs here. And we're just gonna advance.
And he's feeling it.
Bony, infield, dink, dink, dink.
Really?
Yeah. You wanna feel it?
I
Muscles?
trust you.
Okay. All right.
I don't wanna,
You're like, no, I don't.
no pneumothoraxes today.
So yeah, so I would like to see a shoulder blade that reflects comfortably up, and there's gonna be plenty of them, so. Cool. All right, so quick recap. Put the shoulder in a loose position, like that, see that? You can get levator scap, you ought to be able to find it. You should be able to distinguish that from upper traps. And I'm okay if you're hitting both, but we definitely want levator scap, okay? And then rhomboids, make sure we're loose here so we can grip onto those rhomboids. And we're going hand behind the back. We're going to hit the border of the shoulder blade, rhomboid insertion. And if we can get it to reflect enough, then we can come and hit subscap from here. We're also going to hit subscap from here, which is, generally speaking, a lot easier. And this is where I prefer to hit subscap. But if you're already here and you're like, I just need to hit one more muscle, ooh, I can get it here. Let's go. You know what I mean? So it can be a preference or efficiency. Let's do that. Yeah, I'll float the room. I think you're pretty comfortable with these.
Yeah.
Case? Yes, no, maybe?
Not really.
Not really, not yet.
Yeah.
Okay. So preferably me. You've got Iden too. The first couple of these aren't bad, but I think when we're ready for the rhomboid on the border of the shoulder blade and the subscap, let's get eyes on that. Awesome, and break.